Disclaimer: this student created video is a part of a formative assessment and meant only for educational use. The views and content expressed are solely those of a student and which assumes no responsibility for the material presented.
Hello everyone, my name is Harikrishna. I am from J Division, Department AS and H.
I am Agneya Bharale, Division J, Department AS and H. Today we will be presenting a video documentary on the IKS subject for our formative assessment 1. Today we will explore an interesting topic from the Indian knowledge system, the development of dentistry and surgery in ancient India. This presentation will focus on two important aspects of early medical knowledge: the earliest evidence of dentistry discovered at Mehergarh and the remarkable surgical contributions of the ancient Indian physician Sushruta. The history of medicine often focuses on modern discoveries, but many medical ideas actually began thousands of years ago. Archaeological evidence from Mehergarh shows that humans practiced dentistry nearly 9,000 years ago, making it one of the earliest known medical treatments in the world. Researchers discovered human teeth with drilled holes, suggesting that early communities attempted to treat tooth pain and decay. Later, Indian medicine made major contributions through advanced surgical knowledge found in the works of Sushruta. His medical text, the Sushrut Samhita, describes more than 300 surgical procedures and 120 surgical instruments. Let us now briefly explore these discoveries. One of the earliest examples of dentistry in human history was discovered at the archaeological site of Mehergarh, located in present-day Pakistan. Mehergarh dates back to around 7000 BCE, making it one of the earliest known farming settlements in South Asia. During excavations, archaeologists discovered human teeth with small drilled holes. These holes appear to have been intentionally drilled, suggesting that early communities were attempting to treat tooth pain or decay. This finding is considered the earliest known example of dental treatment in human history. The discovery also shows that people thousands of years ago already understood the problems of tooth pain and decay, and they experimented with tools and techniques to relieve suffering. Archaeologists found 11 drilled molars belonging to several individuals at the site. The holes were between 0.5 and 3.5 mm deep, indicating very precise drilling techniques. Scientists believe that ancient practitioners used a bow drill with a stone or flint tip to perform the procedure. These types of drills were already used at the time for bead making and crafting tools, which suggests that same technology was adapted for medical purposes. Interestingly, some teeth showed signs of wear after drilling, meaning that the patient survived the procedure and continued using their teeth afterward. The discovery is important because it shows that people thousands of years ago already understood tooth pain and dental disease, and highlights the advanced practical knowledge of early South Asian societies.
As medical knowledge continued to develop in ancient India, one of the most important figures was Sushruta, who lived around the 6th century BCE. Sushruta is widely regarded as one of the earliest pioneers of surgery. His teachings are preserved in the famous medical text Sushruta Samhita, originally written in Sanskrit. This text consists of 6 major sections called sthanas, containing 184 chapters and nearly 8000 verses. The 6 sections are Sutra Sthana, which explains fundamental principles; Nidhana Sthana, which discusses causes and diagnosis of diseases; Sharira Sthana, which focuses on anatomy; Chikitsa Sthana, which explains treatments; Kalpasthana, which deals with toxicology; and Uttarasthana, which includes specialized medical topics such as eye diseases. The text also emphasizes preventive health care, balanced living, and ethical conduct of physicians. Sushruta believed that surgeons should undergo extensive training before performing operations on real patients. Students were advised to practice surgical techniques on vegetables such as gourds and cucumbers to learn how to make incisions. They also practiced suturing on leather bags filled with fluids to simulate real tissues. This method allows students to develop precision, confidence, and practical experience. Sushruta also recognized the importance of pain management during surgery. The Sushruta Samhita mentions the use of wine and herbal preparations to sedate patients before procedures. Although this was not anesthesia in the modern sense, it shows that physicians understood the reduced pain and anxiety during surgery. Sushruta described a wide variety of surgical instruments, including scalpels, forceps, needles, hooks, and tubes used in medical procedures. Many of these instruments were made from iron or bronze and were designed to resemble shapes found in nature for better precision. The Sushruta Samhita also emphasizes the importance of cleanliness, careful handling of instruments, and proper bandaging to ensure healing after surgery. The text also includes one of the earliest descriptions of cataract surgery. Sushruta described a method called couching, in which a sharp instrument was used to move the cloudy lens away from the visual axis of the eye. This allowed light to reach the retina and partially restore vision. Rhinoplasty and other surgeries. One of the Sushruta's most remarkable contribution was the development of reconstructive surgery, particularly rhinoplasty or nose reconstruction. In ancient times, the nose was sometimes cut off as a punishment for certain crimes. Sushruta described a method of rebuilding the nose using a skin flap taken from the patient's forehead. The skin was carefully shaped and attached to reconstruct the nose. This technique is considered as one of the earliest forms of plastic surgery and has influenced modern reconstructive surgical methods. The Sushruta also describes a procedure for removing bladder stones. The patient was first given wine or herbal sedatives, and the surgeon then made a small incision to carefully remove the stone using a surgical instrument. After the operation, the wound was treated with herbal medicines and bandages to promote healing. From the early evidence of dentistry at Mehergarh to the advanced surgical knowledge described by Sushruta, ancient India made remarkable contributions to the development of medicine. This discovery demonstrates that thousands of years ago, physicians were already exploring ways to understand the human body, treat disease, and relieve suffering. The legacy of these innovations continues to influence the history of medicine even today. Thank you.